welcome to Beat Burnout. I'm your host, Taniya Hussain, and today I have Dr. Lisa Hartwell joining us from all the way from Hawaii. So, as together, top coaches, authors, business owners, researchers, academics, and practitioners who have themselves beaten burnout and who are wanting to share their stories of how they were burnt out and they beat burnout, and also strategies that they use themselves and recommend how you can beat burnout, because I know you out there want to capture the joy in your life. You're feeling so depleted and tired because of the work that you do. Being a social worker, being a healthcare professional is not easy, and I was burnt out last year, being in the social work profession for nearly 3 decades, and it nearly cost me to lose the people that I really love in my life. Luckily, I didn't lose them because I have now found a way to systematically and very strategically maintain a balanced lifestyle. It hasn't been easy, and that's why I'm really passionate and really it's something very close to my heart that we together beat burnout, because we can only do it together. We can only do it, first of all, by recognizing that we're burnt out, and that's something that's not easy, especially when you are a social worker and a healthcare professional. This is really something important, because only when we give to ourselves can we give to others, and especially with our jobs that is so much giving to others, it's really important to replenish ourselves. So our guest today is Dr. Lisa Hartwell, and Dr. Lisa Hartwell is the author of Bad Apples: How to Feel Good When Rotten Things Happen. She's the founder and CEO of Hartwell Therapy and Consulting. She's a clinical and a forensic psychologist, and she's a relationship success consultant and a retreat leader. I'm sure there's loads that I've forgotten because Lisa's well accomplished. Please, could you tell who's watching what I've forgotten? Because you've done so much.
I've done too much. I've had too many careers. How are you? It's nice to be here.
Okay.
Yeah, it's nice to be here. Thanks for having me. Yeah, I actually have gone through 2 iterations of a career. I was a registered nurse. I still actually have my license. And in that work, I did mostly trauma work in the emergency room and as a flight nurse, sprinkled in some psych nursing in there on the side. So a lot of psychiatric work as well. And about after maybe 15 years of that, 10 years into it, I decided I needed to find a new career path, the things that were interesting to me, but a lot of it did stem from, I don't think I can do this when I'm 70. And therefore, that's what led me into this clinical psychology route, and then specializing further into forensics and clinical work. So, yeah.
Wow, you have done so much. I wanted to ask you, I'm sure I briefly described the dark moments that I had this time last year, autumn last year, where I just felt so exhausted, and I actually felt it was to do with something completely different to my job that was making me feel like this. It was only several months later that I figured out that it was my job that was making me feel so bitter and angry. I just wanted to know, was there a dark moment in your life where you realized that you were burnt out? Would you like to share that with us?
Yes, I could actually remember the flight. In my career before as an emergency room nurse, it was my life and my career path was, I really coped with the burnout part of it with traveling. So as a single person, I used to travel a lot all over the world. I would work really hard, and then I'd take 1 to 3 months off at a time. And that's how I coped, I think, back then, in retrospect. I think the time to where I don't think I was ever as burned out as this one particular night. And when I say flight nursing, what I mean by that is I live in Hawaii, right? So We have different islands here, so we would fly to other neighbor islands and go pick up patients. There's
Yeah.
only one reason that you go pick up a patient at 3 in the morning, and that's usually due to trauma. And it's whether it be car accident or drunk driving or head injury or cardiac arrest or something along those lines. So they're always trauma related. And I remember I started having some troubles getting up in the middle of the night for these flights. Like trouble meaning I felt sick. Like I'd be on the flight and I'd be trying to hold it together, and I don't get sick on airplanes. So I couldn't figure out what was going on. And I remember picking up that patient. It was always two of us. It was always either two nurses and then a nurse and a paramedic. But I remember feeling like I couldn't take the pain and the suffering anymore, being exposed to that. And secondarily with, I can't do this anymore at 3 o'clock in the morning. I cannot get up and have a life for myself. And then you're just worn out the next day and I got to do something. And I think that was the moment you're squeezing the Ambu bag to help someone breathe and doing the drugs and everything and thinking, I can't do this. I cannot keep doing this. And I was probably, I want to say it was 29 or 30, something around that age. And not to make it really long, I started doing some exploring of things that I was interested in. And it led me to apply for grad school, to go back into something that I felt like I still really loved. I still really love healthcare. I love patient care and clients, and the psychology realm really helped me pull everything together. So it was a moment. It was definitely a moment when I was like, oh, my body's feeling it. I feel sick. The emotional part of holding people's pain and suffering. Yeah, it was that moment, honestly.
And this is something, I mean, I'm a trauma recovery coach, and when you're being surrounded by trauma most of your life, like you said, you're holding people, and you've done it day in, day out. I've done it for 27 years.
Yeah.
There's a part of you that kind of gets so used to it. And then there's another part of you that, like you said, you start feeling it in your body. You get physical illnesses, you get irritable bowel syndrome, or you have high blood pressure, or you have heart problems, or you get diabetes. But for you just, there was that voice that you said, I can't do this anymore.
Yeah.
And that was very similar to me. Last year I just kept saying, what is it that I want? What do I want? And I never asked that question before. I always, Taniya Hussain just carried on doing it because that's what she does. She holds people, she cares for people, she supports people. But I never asked what I wanted. I did what everybody expected of me. And just sounds like when you started grad school, it was something for yourself. Am I right?
It was twofold. It was for myself, as well as knowing I felt that was the only way as a means to an end to create the family that I wanted to create. Whereas I wasn't setting myself up for that in the life that I was leading, being up all hours of the night and doing these things. So it was twofold. It was actually in the more spiritual sense of where am I going with my life. So it served that purpose, as well as I've always been a bit of a systems thinker in a bigger realm of things. And I felt like, at least with the doctorate degree, I could do bigger things as opposed to just the bedside nursing that I had been doing for so many years. And yeah, it was really for those reasons and the flexibility.
And I think that's what I love about you. Lisa and I just connected just a week ago, but there's just like this really brilliant energy between us. It feels like I've known you for a long time. But because you are an academic and also a practitioner, I just feel like, because you get lots of academics that are just academics.
Yeah.
And you get some that do the day in, the day-to-day work and on the ground. And that's what I love, because embody both worlds.
Yes. Yeah. I have a respect for both worlds. I have a huge respect for academia is what gets us here. And the rest of it allows the glue to be able to help the client or the patient. It does take the marriage of both.
And you mentioned something about systems. I think there was something in your book about orchards. Could you just explain for for those that might not know what systems theory is?
That's true. Yeah. I got introduced to that through grad school, which I really have always resonated with. But what I did is probably about 5 or 6 years into my private practice and doing clinical work directly with clients, I started taking on the role as a consultant with teams and teams that were stuck in working with these difficult clients, and specifically in the forensic realm, which is those that are in criminal justice world. And what I decided to do was to write a book back in 2014, but I knew I couldn't talk about systems. I knew I couldn't talk about all these elements that contributes to a client getting better as well as keeping ourselves healthy. And I came up with what I always talk about in session and consultations, which is the idea of that how we're all essentially a part of an orchard, which is a part of the bigger picture. And within that orchard, of course, there's either healthy or not healthy trees in which we all individually represent. And the idea is that we have to take care of ourselves before we can take care of our orchard, and our orchard's health depends on that. And that's essentially systems theory. But then within systems theory, there's all these elements. And so what I do talk about is I give that some grounding in developmental models. So how do you get there? And that's really what the academic side that you're referring to plays a part.
Okay. And I love that metaphor about orchard, because you said something about there's those different trees, the tree of business, the tree of community, the tree of being a global citizen, the tree of family. And I suppose if you're not watering yourself, how can you then flourish in other areas of your life? If you're not replenishing yourself, you're not giving to yourself, how can you then give to others?
You're right.
You can't give from an empty cup. Especially, I love your kind of work about making anxiety your ally. I think this is one of the ways that you recommend for people to beat burnout. Could you talk a little bit about that?
Yeah, no, my specialty is actually turned into anxiety. So I do obviously see a lot of anxiety in my practice. But the reason I use that as a way to encapsulate the approach that I use with folks, which is most people want to come and they want help with you getting rid of their anxiety. And at some point, there's a learning curve about actually we need to use whatever that anxiety is telling us to use it in our favor to grow us. And one thing that I talk about in all of my workshops and retreats and trainings is there's different types of anxiety, and it's up to you to learn, that's the academic side of which type of anxiety is this, because you need to use it as your ally. It's there as your friend. It's there to inform you so you know what your next steps are. So not everybody, for instance, needs to use their anxiety in a way to just curl up and roll up in bed, right? Sometimes the anxiety is meant to say, oh, maybe I should have paid attention to that conversation because it actually meant something, as opposed to getting my feelings hurt by it or getting angry about it or something along those lines. Actually using that in the context of your life. And that's where that orchard piece grounds you, because it allows you to look at this from a very different viewpoint instead of the suffering that anxiety causes in your body, because it's a way of a suffering.
Definitely. And this is something that I think, being a healthcare professional like you are, being a social worker, I just find that because we are the help, is really hard sometimes to even admit that we are burnt out, that we do need help. And I just wanted to know, that makes it that much harder. What might be able to make that a little bit easier, that we can admit it? Because I think that sometimes we're just so hard to get people to accept. What do you think might make it a bit easier?
Oh, that's a great question. I feel like that's twofold. And the first one is, I feel like that needs to be an element in academia. I think when we're all trained, we should have been trained on how to take care of ourselves in a very framework focused way, just like they teach you how to take care of a cardiac patient. Like they trying to have a framework to teach us how to take care of ourselves. And that just doesn't exist. It doesn't exist in programs. They touch on it, but it certainly isn't a sort of that solidarity thing of, I know when I recognize these things.
Yeah.
And then the other piece to that question, honestly, I feel like, again, it's back to the orchard piece of recognizing who's in your orchard. And the biggest thing is always having that and having the preventative sense of knowing when you're going to reach out. So at least in a lot of areas that I work, there's regular consultation and mentorship and supervision, or honestly, just having a cup of tea with a friend. There has to be that element that you recognize, I think I just need a conversation with someone to get my head back on straight. And then if my head doesn't feel straight and that person's starting to feel like it's too much of a therapist relationship, then maybe it's time for me to feel comfortable and seeking out support from either a coach like yourself or a different venue. Some people go on vacations and they feel better, but it's about that self-awareness of knowing where you are in the continuum of burnout and not waiting until you're at the end of the wick, essentially.
Hold on to that. I want to go back to that continuum of burnout. Yeah, I'm really interested in that. But this is something that you've really touched upon, in that in our fields, whether that's social work or psychology or being in the criminal justice system or nursing or medicine, there are, like, it's, as like you said, it's touched upon, but systems aren't in place to actually support people, like they're not incorporated. For instance, I've been doing a social worker for 27 years, and only 2 years ago was I introduced to the concept of vicarious trauma. Obviously, I knew about burnout. I knew that when I was training, but vicarious trauma, the fact that you can become traumatized by your client's trauma, not your own direct trauma, but indirectly your client's trauma, just holding them. And sometimes we see such, it's, you work in the criminal justice system as well, really harrowing scenes. I think sometimes when you are like so used to it, so easy to intellectualize all the emotions, like in some sense intellectualize it, so then you just stop feeling it. When you stop feeling it, then your body manifests it in different ways,
right?
And like I'm saying, it's sometimes you have to get into a very dark, desperate place to even then recognize that you need some help or support. And what I realized sometimes was doing what we do, trauma recovery work, forensics, whatever it is, this criminal justice, it is that you've got to be very strong. But sometimes, wouldn't you say, Lisa, your strength can be your vulnerability, and your vulnerability, I found out in my case, was when I actually started saying I'm not okay. That was my strength, because then people started helping me.
I love that. Yeah, no, I love that. I think what I was flashing on when you were saying that is the goal would be that you're not waiting until you're wounded yourself. The goal is that you are seeking help. For instance, when you have, I was sick this last weekend, right? When you have a sore throat. So you start treating the sore throat so it doesn't turn into bronchitis, pneumonia, et cetera, et cetera. To me, my medical model kind of kicks in, that it's the same idea, that continuum of understanding where you are on that scale of burnout to where you can seek support. And there's something about medical illness that makes us feel vulnerable. You feel like you can't function. But yet everybody's okay with you laying in bed for 2 days straight because you can't function. They're not okay with you laying in bed because you're burned out. It's just looked at as very different. And it shouldn't be. It shouldn't be.
It shouldn't be. And that was, explain a little bit about the continuum of burnout. I'm sure people watching would really be interested in that. And you led me on to my next question, but could you explain a little bit about the continuum, what it involves? What's the range?
I think just to simplify it in simple terms, other than using the developmental models, which goes into it a much deeper, The idea is going from stress to anxiety more continually to burnout to where you can't function. So the idea is you'd like to catch it somewhere between the stress and the anxiety stages. So the stress is just the normal stress. You feel like you're exhausted at the end of the day, but you actually recover. You actually get up and, okay, I got a new attitude and I can keep my sense of humor and I can get back into it. Anxiety is to where, okay, now I'm starting to feel it across a few different areas, right? Like you said, and get a little snappier at the kids, or my appetite's changed, or I feel like my sleep has changed. It starts to affect different systems. That would be when you'd be like, maybe I need to take a little bit of a break and either have, like, again, have a conversation, time for a vacation, time to do some personal development work. What does the bigger picture of this mean, et cetera, et cetera. That would be what the overarching continuum looks like. Does that make sense?
Yeah, that makes sense.
Yeah.
And I you talked about anxiety not being this scary monster and being your ally.
Yeah.
What other strategies would you say you use yourself or you would recommend to beat burnout?
I would say some of my personal strategy involves a daily practice. And I think I call it a toolbox, is what I refer to it in my trainings. We all have to develop our own toolbox, but that toolbox can be anything, such as myself. I do journaling as well as meditation daily. Sometimes I do meditation twice a day, depending on what the day holds. But that practice grounds me. And I think the overarching goal is to keep in that steady state of feeling grounded. And that would be the goal, is a daily practice and building the practice. And then on a bigger scale, developing an idea that you do maintain that orchard mentality of connection to others. So are you doing regular practices to connect with others, whether that be in your smaller social circle or on a bigger community scale or even more social involvement issues? When you think about it, all of those techniques or interventions for ourselves serves the purpose of keeping us at baseline. And so therefore it's about having that, I always call it having the boots on the ground and having the 25,000 foot at the same time. And the way you get at that is through having that sort of ongoing practice, which is what, again, way back when it was working for me for all those years as a nurse, was the frequent travel. I would literally go on a very long vacation once a year and probably 2 or 3 throughout the year, short ones, like 2 or 3 days. And I realized, I was using that as my coping skill back then.
You were replenishing, yeah. Sounds like you were replenishing. The daily journaling and the meditation is something that I kind of talk about. I've done a lot of Facebook lives, and this is something I recommend to my clients. It's something I practice myself. But there was just something that you were just saying about grounding yourself, because sometimes to have that grounding yourself, and also you said something about the orchard and having those connections with other people. I'm sure, and there's lots of people write about this, and I constantly blog about this, is the fact that the world that we live in, where we're constantly looking at our phones and laptops, you don't often get that eye-to-eye contact with someone, and that eye-to-eye contact can be so life-giving and nourishing, because you're just constantly like messaging, and that kind of disjoints communication. I'm not saying it necessarily makes it shallower, but that real face-to-face, eye-to-eye contact is one of the most highest forms of communication, much more richer. And I think this metaphor that you have of an orchard really brings the whole thing about how you connect with people really to life. I just love that metaphor that you have.
Yeah, it's so beautiful, isn't it? It's really,
yeah,
it just makes so much sense and has such a peaceful notion to it.
I can almost see myself in the orchard right now. I know you've hinted at it, but I just wanted to capture it for the people that are watching. What do you say would be the top 3 to 5 signs that to watch out for, that might have, you've mentioned it in the continuum, that might make you go from anxiety to burnout? What would you think would be the top 3 to 5 signs that you need to watch out for, so viewers can at least take that away from this interview?
Yeah, no, that's a great question. I would say it looking at it on levels of severity. That would be the word I would use. For instance, the difference between irritability and anger. So one of the top signs would be start watching yourself when the irritability starts to come up. And I call it cactus. It's just like you feel prickly. You
Uh-huh.
feel like, don't touch me, don't hug me. I'm just feel a little like irritable. But you're not angry, right? You just feel uncomfortable. That would be definitely a sign. The Another one that always impacts people is insomnia. People treat insomnia with pills or smoking substances and such, or drinking wine and or alcoholic things, and to each his own. But the point is, it's more about the change in your behavior. If you're finding that you're needing more and more, that your thing isn't working anymore,
Mhm.
that would be a telltale sign. Another one for sure, I break it usually into your interpersonal functioning and then your relationship functioning. So if it's a matter of you're starting to feel more argumentative than normal, that would be another sign, whether it be with people at work, with your spouse, with your kids, with the person at your pharmacy. You just feel more argumentative and testy. That would be a recognition. And then maybe the final one would be when it manifests physically.
Okay. Yeah.
The other one I would touch on, it's probably would be like a whole nother conversation, would
Mhm.
be the when you're feeling like you have what people know as an existential crisis, which means you've lost your meaning, you've lost your hope with what you're doing. And that's a little bit higher on the continuum. There's this little bit of push about this just doesn't even make sense anymore. And that's a real big one for people who are working, number one, in trauma and definitely with criminal justice clients.
And that is when sort of depression has probably
Yes.
released
And
and
anxiety too, because anxiety is probably the precursor to that, because you feel just more anxious about hearing the stories and not wanting to hear the stories. And it's where and you don't necessarily feel sad about it until you feel hopeless.
I
But
had a case. It was in the national papers and social work professional magazines of a social worker who took her life. And yeah, it was something that really touched me. And I think there was going to be an inquiry about why that happened. But like you said, when you have that existential crisis, that you lose any joy, any meaning in life, it's it's something that sometimes I know, like I was like saying before, because you're so used to helping others, it's very hard. I know in my case, in my life, this has been really difficult. And it's only in the last year I've realized not we know we are not lone islands, we are interdependent, and interdependence is real, is a strength. It's something that we all need as human beings.
yeah,
But it's something very difficult to do when you have just most of your life spent helping and helping. And when you start isolating yourself, because I think that would be another
another
sign
one.
when
Yeah.
somebody's not talking, they're not talking to people that they love. They've just completely isolated themselves and they're getting really quieter. I'm sure there will be people watching that are actually thinking about colleagues or friends or family members that they have tuned in because they might not themselves be burnt out, but they're thinking about somebody in their life that
Exactly.
is burning out or is burnt out. That would be, I would say, one of the signs. But what you've described, those signs, that I just think that's really brilliant, and I'm sure people are going to take that away. I just also wanted to ask you, where else would you go for help? I know you've talked about it, a friend, a colleague. Where else would you recommend going for help if you're worried about burnout?
I think everybody's different in Hawaii, and London's the same way for sure, as far as various cultures. And so the sensitivity is always that people reach out for support in different ways,
Mhm.
and whether it be pride that doesn't allow people to reach out, or whether it just be a cultural thing, you just don't do that, you suck it up. I think the avenues that are they're out there for people are so much more vast nowadays. For instance, even if it's something as anonymous as joining a online support group. So nobody knows your name. You get to be able to get some reassurance and support in that way. I think it's a free way. It's an anonymous way for you to get help without
Yeah.
putting it out there. And then of course, I think in-person support groups is always phenomenal when they're out there. You could start a support group if you have that personality. And then of course, there's always our more traditional, either seek out a coach or a therapist, of course, or I do the retreats and such for the healing. But the idea is knowing that those things are out there for people. I think it has to be a fit for you though. Some people don't do well in groups. Some people do much better one-on-one. I have quite a few clients that do telehealth, which is on the computer. Some people are like, yeah, thank you for offering that, but I really want to see you in the office. Everybody's just different in that way. And it's about figuring it out for yourself first, I think, and then reaching out for the modalities out there.
And in the UK, there's a lot of free help because we have a national health service.
Oh, yeah, that's right.
You can always go in this country to go to your GP and talk with your GP in confidence. There's free mental health support. There's even such a thing as, if you don't want to do face-to-face, you can do like text counselling. So thank you so much, Lisa, for your time. Super brilliant tips that you've given us. I'm going to say thank you for joining us. Thank you for joining Beat Burnout Summit, and I will be back tomorrow with another guest. And thank you so much for watching.
Thank you. Aloha.